the front. It's the front view. So again, your rotator cuff's supposed to come across here and attach all the way over here, but yours really ends here. You can see it never really goes past that point. And so it's pulled off that size, which is about real life size. So in your shoulder, we're talking like that. Mm-hmm. And so this space between the ball and the bone above it is supposed to be like that, but it has become almost bone on bone. Okay. Corresponding to that, upward movement, this is the bottom of the ball right here, and this is the bottom of the socket, and those are supposed to be level. So just like you see it's moved up there, it's moved up there too. The other thing is that, just to show you that it's been there for a long time, this is looking into your shoulder. This is from the side view. That's called a sagittal view. And this circle here that I'm drawing is supposed to all be this dark muscle. Mm-hmm. When it's been torn for a long time, that muscle shrinks down and it gets replaced by fat because it just fills the space. And so this area, once it's greater than 50% fat, then you call it non-repairable. Oh, yours is probably 75% fat. So that muscle is gone.
That's why you think it's an older injury.
That's why I think it's an older injury, yeah. Mm-hmm. So your options, you've already had a steroid shot. The steroid shot is great. That's what I would start with as well. It is just to get rid of inflammation. It's not to regrow the rotator cuff or open up that space. It's just for pain and inflammation. And if it worked well, you can repeat it up to every 3 months as needed. Physical therapy can also help. So whereas like bone-on-bone arthritis in your knee, physical therapy doesn't really help very much. But in your shoulder, strengthening the other muscles, not your rotator cuff because it's gone, but strengthening like your deltoid, these other muscles, that can help. So that is definitely an option as well if you haven't done that. The last resort is a shoulder replacement. I'll show you on that paper. Let me grab it. I'll grab it. No, it's okay. All right, so this is a thing called a reverse shoulder replacement. Can you get me the reverse shoulder model? They'll get it right.
Well, before you go down that path, do you mind talking about the repairability or non-repairability?
So once it's torn past the level of the socket, which yours is, and once it's more than 50% atrophied, so it's more than 50% replaced by fat, then it cannot be repaired. And yours is well past that.
Okay. So her retracted muscle, where does it show up on her? You said it was torn.
Retracted. So once it's past like this point, and yours is already pulled back to this point, so you can't stretch it out.
You can't like go grab it and pull it over.
Not at this point. And again, the muscle is gone. It is now just fat. It's replaced by,
So in your opinion, the fact that she's just now seeing you isn't the driving part of repairability, that it was doing this for over a long period of time.
Over years.
And it just went back hard.
Right. So at some point it was repairable. Yeah. But it's probably been, I can't tell you how long, but I can tell you it's probably been non-repairable for quite some time.
Okay.
Yeah. A year or 2 years, I don't know how long, but...
So don't feel bad about waiting to see
quite some time. But I understand your question. Like if you would, say this happened in that car accident. If you would have gotten an MRI and seen that you had a tear, because initially it tears off the bone like that, and then over time it comes back. So if you would have fixed it initially, would we have been in this situation? No, we would have been able to fix it at some point. But then on the other hand, if it wasn't bothering you that much, you're just kind of like, I'm just going to deal with it and get through. Of course, that's what I would do too. I wouldn't just run to fixing something if it wasn't bothering you that much.
Yeah, right.
So you didn't do anything wrong. But yes, the length of time between the time that it tore and now is the reason that it's non-repairable.
Do you recall Claire getting an MRI done after that car wreck? You
were
rear-ended.
Yeah. I got a new roof instead.
Right.
Me and Jose, we went to stay.
Yes. All right. Well, the last resort. So we can try. You've had an injection. We can try physical therapy. The last resort is
okay. Now start a new video, and so I can see.